Across the world, investing in the health sector is a critical driver for efficient service delivery. As the demand for quality healthcare and modern health infrastructure continues to grow, government and corporate bodies have a vital role to play. It is therefore necessary to put in place sustainable measures towards addressing the critical challenges facing the health sector so as to improve healthcare outcomes. In Ogun State, this understanding has continued to shape the administration of Governor Abeokuta over the last 7 years. Under his visionary leadership, the healthcare sector has recorded steady and measurable progress, from rehabilitation of the primary healthcare centers to equipping hospital facilities. These have placed Ogun State on the path of sustainable progress in the health sector. Recently, the state government commissioned the PHARMA-grade warehouse of the Ogun State Drugs and Health Commodities Management Agency, a strategic investment with support from Global Fund aimed at strengthening healthcare delivery and distribution of essential medicines across the state. Speaking at the official commissioning of the PHARMA-grade warehouse held at the governor's office, NTA Abeokuta, the governor, Prince Dapo Abiodun, harps on the importance of collaboration in strengthening healthcare services, saying that it is a vital component at advancing Nigeria's health priorities.
Health is not a luxury. It is a fundamental human right and the foundation upon which all human progress is built. These timeless words remind us that the strength of any society is measured by the health and well-being of its people. It is therefore with profound honor, deep gratitude, and immense pride that I welcome all of you on behalf of the entire government and good people of Ogun State to this very remarkable occasion, which also marks the visit of the Executive Director of Global Fund, Mr. Peter Sands, and the commissioning of the Ogun State Central PHARMA-grade warehouse, built with the support of Global Fund and also contribution from the state government. It is the reaffirmation of our shared commitment to protecting lives, strengthening health systems, and building a healthier future for our people. It also demonstrates what can be achieved when governments, development partners, the private sector, civil society, and communities work together towards a common goal. I wish to sincerely appreciate the Country Coordinating Mechanism Nigeria for its dedication to ensuring that global health interventions translate into meaningful improvements in the lives of our citizens. Its role in fostering collaboration among stakeholders remains vital to advancing Nigeria's health priorities.
The governor explained that the interventions of the Global Fund in the country has strengthened the system that makes healthcare delivery a success.
Let me welcome especially Mr. Peter Sands to Ogun State. Your presence here highlights the critical role of states in strengthening Nigeria's healthcare system. We deeply appreciate the Global Fund's support to Nigeria since 2003 through investments in HIV, tuberculosis, malaria, health system strengthening. The Global Fund was established to mobilize resources to end AIDS, TB, malaria as public threats while strengthening the systems that make healthcare delivery possible. Across the world, its investments have supported treatment, prevention, testing, laboratory services, community outreach, procurement, storage, and distribution of essential health commodities. In Nigeria, the Global Fund has significantly expanded access to HIV treatment, TB diagnosis, malaria prevention, and the availability of life-saving medicines and commodities. Its current grant cycle continues to support efforts targeted at women, children, adolescents, vulnerable groups, and underserved communities. For states such as Ogun, the value of these investments is reflected in our hospitals, primary healthcare centers, and our communities. The commissioning of the Ogun State PHARMA Grade Central Warehouse is one of the tangible outcomes of this partnership. This facility is not merely a building. It is a strategic investment that will improve the storage, management, and distribution of essential health commodities. It will strengthen supply chain efficiency, reduce stockouts, and ensure that medicines, test kits, and critical health products reach healthcare facilities and patients across the 20 local government areas in a timely manner.
Governor Abiodun spoke on the commitment of his administration in combating public health challenges in the state.
Distinguished ladies and gentlemen, HIV, tuberculosis, malaria remain significant public health challenges. Yet, through sustained government action and strong partnerships, we are making measurable progress. More than 30,000 residents of Ogun State living with HIV are receiving free antiretroviral therapy, counseling, and support services. We continue to strengthen prevention programs, expanding testing services, and reducing new infections. Our commitment to eliminating mother-to-child transmission of HIV remains firm because every child deserves a healthy start in life. We are also scaling up targeted interventions for vulnerable populations to ensure equitable access to healthcare services. In the fight against TB, we have intensified case detection through community outreach, contact tracing, and hotspot mapping. Access to diagnostic services, including checks, x-rays, and laboratory testing, has been expanded, while treatment remains free and accessible. Our message is clear. Tuberculosis is preventable, detectable, and curable. Similarly, our malaria control strategy focuses on prevention, early diagnosis, and prompt treatment. Through partnerships with organizations such as the Global Fund, we have supported the distribution of insecticide-treated nets, strengthened public awareness campaigns, and expanded access to rapid diagnostic testing. Our goal is to significantly reduce malaria and deaths, particularly amongst pregnant women and children under 5. Our approach to healthcare is also guided by sustainability and local ownership. In collaboration with the Clinton Health Access Initiative, we have established a health systems sustainability task force to ensure continuity of essential health services and strengthen long-term planning.
The state helmsman reaffirmed his administration's continued support to healthcare service in the state.
Technology and innovation are equally central to our reforms. Through digital health platforms and real-time surveillance systems, we are strengthening disease monitoring, improving decision-making, and enhancing service delivery across the state. However, government efforts alone cannot achieve our goals. We encourage all residents to embrace preventive healthcare practices, participate in screening programs, utilize available health services, and enroll in the Ogun State Health Insurance Scheme, which remains a key pathway to affordable and accessible healthcare. Ogun State's contribution to healthcare extends beyond service delivery. Our state continues to serve as the pharmaceutical industry hub of Nigeria, supported by a conducive business environment and a commitment to the ease of doing business. This has enabled us to attract major investments in pharmaceutical manufacturing, medical technology, and healthcare innovation. A clear and visible example is Codex Bio Limited, a leading rapid diagnostic test manufacturing company located in Ilishan, Remo, Ogun State. Ogun State is proud to be contributing to the development of indigenous solutions that support healthcare delivery within Nigeria and the African continent. As we look ahead, our vision is clear. At Ogun State, where HIV infections are drastically reduced, tuberculosis effectively controlled, malaria no longer a major public threat, and every citizen has access to quality healthcare services. This vision aligns with the renewed hope agenda of Mr. President and our commitment to building our future together.
Earlier in a welcome address, the Commissioner for Health, Dr. Tomi Kuka, noted that the PHARMA Grade project will significantly improve storage and distribution of essential medicines across the states.
It gives me great pleasure to warmly welcome you all to this historic occasion, the official commissioning of the Ogun State Drug and Health Commodities Management Agency PHARMA Grade Warehouse, strengthening healthcare systems, improving supply chain management, ensuring uninterrupted access to quality medicines and health commodities for our people. Under the visionary leadership of His Excellency Prince Dapo Abiodun CON, the Governor of Ogun State has continued to make significant investments in health infrastructure, healthcare workforce, and health system strengthening. The commissioning of this state-of-the-art PHARMA-grade warehouse is another testament to this administration's unwavering commitment to improving health outcomes and achieving universal health coverage for all our residents in Ogun State. This facility is designed in accordance with international recognized pharmaceutical storage standards and will significantly improve the storage, inventory management, and distribution of essential medicines and health commodities across our health facilities. It will undoubtedly enhance commodity security, minimize wastage, improve accountability, and ensure that life-saving products remain safe, effective, and readily available to those who need them.
Goodwill messages poured in from stakeholders within the health sector at the event.
This facility represents much more than just a building. It's an investment in the health and well-being of the people of this state. And through the C19RM grant, the Global Fund supported the upgrade of this warehouse as part of a much broader effort covering 22 warehouses in different parts of Nigeria. But I want to acknowledge the fact that this funding did not just come from the Global Fund. And I really want, Your Excellency, to commend the partnership and the contribution of 15% from Ogun State itself. That's a strong symbol, a strong demonstration of your government's commitment to the health of the people of this state. When you think about the way a health system functions, the logistics, the supply chain, are as vital as any other part of the delivery system. The physical infrastructure is only part of the solution. Just as important are the governance, the leadership, the systems, the trained staff to actually make it all happen.
This warehouse is one of 22 that UNICEF built across 21 states, together with the Global Fund and the Federal Ministry of Health and Social Welfare. The real story, of course, is getting medicines, vaccines, and health supplies to the people who need it on time and in good condition. That is why this facility was made possible. When this warehouse works as it should, 7.5 million people in Ogun State will feel it. A child with severe malaria, for instance, will get treatment because the drugs are in stock. Mothers will no longer leave the clinics empty-handed. Medicines will be there, the medicines that they need. Supplies will not expire on the shelf. And health facilities will not turn people away because stocks have run out. None of this would have been possible without the support of the Global Fund. And Peter Sands, I want to thank you for your generous contribution to the state, to the country. This facility is, of course, a product of your investment and your belief in the Nigerian health system.
On behalf of the Federal Ministry of Health and Social Welfare, I congratulate the government of the people of Ogun State on the successful completion of this important facility. The Ogun State Central Medical Store represents far more than a physical structure. It is a strategic investment in effective health commodity management, improved healthcare delivery, and better health outcomes for our citizens. My coming here is like seeing is believing. I saw the picture before and after during the official commissioning of the Abuja Premier Wells on the 16th. So coming to see it physically was, oh, this is massive. Well done. I wish to express the profound appreciation to His Excellency for his visionary leadership, because if he doesn't buy in, we won't be where we are today. Ogun State is one of the 21 states that benefited from the warehouse upgrade investment under the GC7 and C19 RM grant. It is also among the states which are established and functional drug management agency. This investment is therefore timely, as we believe it will serve a critical instrument towards achieving maturity and efficiency in the state health supply chain system.
The completion and commissioning of this warehouse is a clear demonstration of the government's commitment to ensure the availability, proper storage, and essential medicine, vaccine, and medical supply across the state. I wish to especially commend His Excellency, the Executive Governor of Ogun State, Prince Dr. Abeokuta, CON, for visionary leadership and unwavering commitment to the health sector under his administration, healthcare, infrastructure, and service delivery.
In 2014, when we started with a project called NSCIP, National Supply Chain Integrated Project, our hope and effort then was to have a country that is centrally managed in terms of supply chain. Because as at that time, we have disarray of supply chain system. States running essential medicines separate. The public health programs are being managed differently under a room without air conditioner. And that's initiated the journey so far. With Ogun State and all other states that have benefited from the effort of the country coordinating mechanisms to have a pharma-grade warehouse and support the supply chain system, I believe Ogun State will make us proud. The other states that we are yet to deliver this kind of facility, with the results that we are getting from Ogun State, I think that might also, with the support of the Global Fund, facilitate the same infrastructural strengthening in other states.
Some participants at the event spoke with Giant Strides crew and they expressed their optimism on the project.
The Governors Forum in Nigeria, we're just thinking of the health of stock that we have in public health facilities. And they came together and thought of the fact that what if we are doing group procurement? Is it possible that we get a cheaper drug and we'll have access to it? And we'll have it all, instead of people doing some disjointed procurement of drugs and you can't control quality and all that. Just like a dream. And they started. So it became a law. A law was enacted that drug management agency should be established in all 36 states of the Federation, and there will be control. And then the appointment of an executive secretary who is going to be a pharmacist that is putting the right peg in the right hole. Let's see what is going to happen with the right people in logistics. And that was how we started, and with support from some partners and working in collaboration with the federal government and the state governments. Already the impact is being felt. I can tell you that since we started operation, we're able to reduce the cost of drug, and we have been able to establish quality. Every drug that comes here, we test the quality. And after testing the quality, because we are procuring, we mean that we are buying for over 600 facilities in the state, we are able to get cheaper costs. And our patients in the hospitals are getting cheaper and quality drugs. And of course, they are noticing it everywhere. And it's a beautiful thing to see.
It is very commendable. As a trusted supply chain partner of the Ogun State Drugs and Supplies Management Agency, the coming together of the supply chain maturity that they have attained with the practical aspect of it, because this is basically where it starts from. And also, it's not just a ceremony to, open up a warehouse. It's an investment, a critical investment in health security. It's an investment in supply chain resilience. And it's also an investment in access to quality, affordable, life-saving commodities for all the citizens of Ogun State. As you know, we have the need that exists, and we have the emergency needs that come as a result of an outbreak, a pandemic. And so this is what would secure the people of Ogun State. This can take a lot of commodities all at once. I think what I would say is that Ogun State government has started well. The 15% investment to support this warehouse is a step in the right direction. A big, appreciation to His Excellency, the Executive Governor of Ogun State, for this very great work.
This is a welcome initiative, and it has actually raised the feasibility and actually also improve our supply chain management, whereby the distribution of drugs will now be last mile delivery, and the security of the drugs and other commodity for health will also be well secured. And the availability of the drugs and the access to it is also ensured by singular effort of His Excellency, and it's a very commendable effort. It is definitely going to improve the health outcomes of Ogun State, because now our clinics and our hospitals are not going to be only a consulting of hospitals, whereby the drugs and other essential commodities are necessary for improving the health and the welfare of the Ogun State citizenry will be ensured.
The commissioning of the PHARMA grade project underscores the vital importance of sustainable partnerships as a shared responsibility of providing affordable drugs at the grassroots. Indeed, the administration of Governor Dapo Abiodun in Ogun State is not resting on its oars at ensuring that the welfare and well-being of the citizenry remains paramount in its agenda. Ìgbéga ìpínlẹ̀ Ògùn, àjọṣe gbogbo wa ni.